Hi, you guys. Welcome back for our daily practice questions. It is day 186 and the Pharm series continues. But as always, I first like to get into my introduction and disclaimer before getting started with our question for today. For those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success in their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. But with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my MP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description, where it houses all of the resources that I offer for first-time test takers as well as those who are retesting. Also, if you're looking to join the upcoming 5-week intensive review, the class starts August the 11th and runs through September the 12th. Early bird enrollment is now available, which saves you $100. Grab it before it ends. All right, you guys, question number one for today. A 68-year-old postmenopausal woman is diagnosed with osteoporosis. Her T score is negative 2.8 after a DEXA scan. She has no history of fractures. What is the most appropriate first-line pharmacologic treatment? Is it A, denosumab? Is it B, raloxifene? Is it C, alendronate? I don't know why that word I can never, ever say. Or D, calcitonin nasal spray. So A, denosumab, B, raloxifene, C, alendronate, or D, calcitonin nasal spray. Take a moment and tell me what you got, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, what is the most appropriate first-line pharmacologic treatment? And as I always tell y'all, if they're asking for a treatment, you need to run it back and see if they provided you with a diagnosis. If they have provided you with the diagnosis, then you can proceed with looking to see what the stem of the question is saying as far as the treatment, like first line in this scenario. And if the diagnosis is not provided, then you need to run it back a step further and look at those assessment findings, because you got to know what it is to be able to treat it, right? So here, the diagnosis is provided. It states that they were diagnosed with osteoporosis and it's asking for first line therapy, right? So your best answer is C, your alendronate. Ooh, look how I did that. It's C, alendronate, because it's a bisphosphonate. Remember, bisphosphonates are the first line therapy for osteoporosis. C is your best answer. All right, question number two. A 64-year-old woman with osteopenia, T score of negative 1.9, and a FRAX calculated 10-year hip fracture risk of 4.2%. What is the most appropriate next step? Is it A, begin calcium only? B, recommend bisphosphonate therapy? C, repeat the DEXA in 5 years? Or D, start hormone replacement therapy? So, stem of the question states, what is the most appropriate next step? So, you have to look back at what's going on. So, this patient has a diagnosis of osteopenia. And although that we would typically do like lifestyle modifications and consider weight bearing exercises, they have a higher risk for fracture. So you want to recommend bisphosphonate therapy. Question number three, which of the following is part of evidence-based outpatient management for all patients with osteopenia or osteoporosis? Is it A, avoid all weight-bearing exercises, B, calcium 1,200 milligrams per day, and vitamin D 800 to 1,000 IU daily? Or is it C, encourage high protein, low calcium diet, or D, recommend long-term corticosteroids? Take a moment and tell me what you got. All right, so stem of the question here. The stem is the question is the stem, and it states which of the following is part of evidence-based outpatient management for all patients with osteopenia or osteoporosis? And your best answer is B, calcium 1200 milligrams daily, and vitamin D 800 to 1000 IUs daily. Remember, with anybody with bone loss, you want to incorporate your calcium and your vitamin D and also encourage weight bearing exercises. So, B is your best answer. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one, at gmail.com. Everything that I offer is linked in the bio of this channel, including my website. And as I mentioned earlier, my website is also linked in the description of this video that houses all of my resources. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.